All right, let's talk about the Kentucky Aesthetics exam. It really is the final boss battle standing between you and your license. And yeah, it can feel like this huge, intimidating mountain. But today, we're going to give you a battle plan to conquer it. So get this. The potential question bank you're up against has over 600 possible questions. That is a lot of questions, and when you see a number that big, it's totally normal to feel a little bit of panic setting in. But listen, take a deep breath, because here's the secret. You are not going to memorize 600 random facts. Who has time for that? No, you just need a strategy. And that's exactly what we're going to do right now. We're going to boil that entire exam down to the core pillars of knowledge they are really testing. If you master these key concepts, you've mastered the exam. Simple as that. So pillar number 1, and honestly the most important one, the foundation of safety. This is the absolute bedrock of your entire career. So many questions pull from this area because, let's be real, if you can't keep your clients safe, nothing else you do matters. First up, you have to know the decontamination hierarchy. Think of it like 3 levels of clean. So at the bottom, you've got sanitation. That's just basic cleaning, wiping away stuff you can see. The next step up is disinfection, which kills most of the bad stuff. But the top tier, the gold standard, is sterilization. That's the total wipeout of all microbial life, even those super tough spores. The exam loves to trip people up on the difference between these 3, so lock them in. So who's making all these rules? Well, it comes down to 2 big agencies, OSHA and the EPA. Here's an easy way to remember it. Think of OSHA as the workplace safety cop. They're there to protect you, the esthetician, with rules like the bloodborne pathogen standard. The EPA, on the other hand, is like the product safety inspector. They're the ones who make sure the disinfectants you're using are actually effective and legal to use. So OSHA has your back, and the EPA has your bottle. All right, let's move on to pillar number 2, the science of skin. This is where I get to geek out a little bit, because you can't treat skin effectively if you don't understand how it works, right? This knowledge is what really separates the pros from the amateurs. So everything starts with the epidermis. This is your skin's protective shield. It's the tough outer layer facing the world. And here's a key fact to remember for your exam. It has no blood vessels. None. That's why a little paper cut doesn't bleed. It completely depends on the layer below it for all its nutrients. And right underneath that shield, you've got the dermis, the support structure. This is what they call the true skin because this is where all the magic happens. It's this living, breathing factory that contains your collagen for firmness, your elastin for that bounce back, plus all the glands and hair follicles. Almost every treatment we do is aimed at making this layer happier and healthier. Now, let's talk about the superstars working inside the dermis. You've got keratin, the protein that makes your skin tough and waterproof. Then there's collagen, which is like the mattress frame holding everything up. When it breaks down, you get wrinkles. Elastin is like the springs in that mattress, giving skin its stretch. And finally, you've got melanin, which is your skin's own personal sunscreen. Know these 4 and you're golden. Okay, so we've got the safety rules down and we know the science. Pillar 3 is all about putting that knowledge to work with the esthetician's toolkit. We're talking products, chemistry, and all the cool tech you get to use. Now, a huge part of that toolkit is using acids for exfoliation. But the exam is definitely going to ask, do you know which acid to use for which job? This is one of the most common points of confusion, so let's clear it up right now. It's the classic showdown, AHAs versus BHAs. And here is the absolute easiest way to remember the difference. AHAs, like glycolic acid, are water-soluble. That means they work on the surface of the skin, dissolving that glue holding dead cells together. BHAs, like salicylic acid, are oil-soluble, and that's their superpower. It lets them dive deep into a clogged, oily pore and clean it out from the inside. So for surface texture, think AHA. For deep cleaning pores, you need a BHA. And that same idea of matching the tool to the job applies to pretty much everything, especially masks. It's a really simple concept. If a client has oily, acne-prone skin, you'd reach for a clay mask to soak up that excess oil. For someone with dry or mature skin, a creamy, hydrating mask is what they need. And for sensitive or irritated skin, a cooling gel mask is going to be their best friend. The exam is all about making these kinds of connections. So, you know the science. You've got your tools. But what makes you a true professional? Well, that brings us to our 4th and final pillar, the rules of the profession. This isn't about chemistry, it's about the ethics and the legal lines that you cannot cross. This is what builds trust and protects your license.
And it all starts with this one phrase. This is half of the most important mantra you will ever learn as an esthetician. Recognize and refer.
But never diagnose. Say it with me. Recognize and refer, but never diagnose. Your job is to be an expert in improving the appearance of the skin, not to act like a doctor. If you see something suspicious or outside your scope of practice, you refer that client to a physician. End of story. This boundary is absolutely critical.
And that mantra is part of a larger professional code. It means every single service starts with a thorough client consultation. It means you keep client information private. It means you stay in your lane. We improve appearance, we don't treat disease. And bringing it full circle back to our first pillar, it means you always use universal precautions, treating all bodily fluids as if they're infectious.
And there you have it, the 4 pillars: safety, science, tools, and professionalism. That's it. So let's wrap this up and lay out your clear path to passing this thing.
Here it is, your 4-step study guide. Number 1, master safety first. You have to know infection control inside and out. 2, understand the why. Know the science of skin. 3, know your tools. Be an expert at matching products to people. And 4, act like a pro. Always uphold the highest ethical standards. Seriously, you've got this. What we just did was take that terrifying mountain of 600+ questions and shrink it down to just 4 core concepts. If you focus your studying on these 4 pillars, you will walk into that exam feeling confident and prepared.
So in the end, this is about more than just passing a test. It's about launching your career. You have the knowledge, so the only question left is, are you ready to be a professional?